Oxygen deprivation can lead to brain damage and even death. Today in this video, we will be discussing about oxygen deprivation. Now what exactly this means? This means that your body or some specific organ do not receive the required amount of oxygen it needs. Now this can be a life-threatening condition which can cause rapid organ damage, especially brain and heart. If the heart and the brain do not receive oxygen for a few minutes, it will lead to confusion, rapid breathing, cyanosis, in which skin turns blue, and even unconsciousness. Oxygen deprivation, in medical terms, is known as hypoxia. It means low tissue oxygen or anoxia, in which the tissues and organs receive no oxygen. Oxygen deprivation is of different types, like hypoxia, in which tissues do not receive sufficient amount of oxygen. Another type is anoxia, in which the supply of oxygen is completely absent. The third type is hypoxemia, in which the concentration of oxygen is low, specifically in the blood. Now, why this problem happens? The causes of this problem may be breathing issues like in asthma, pneumonia, COPD, choking, high altitudes, maybe smoke or dust inhalation, carbon monoxide poisoning, maybe heart failure, and drowning, etc. Now, why this oxygen is needed? Well, every cell in your body requires oxygen to function. When you breathe, oxygen passes through your airways into small air sacs in your lungs and then into your bloodstream. Oxygen levels can be measured by taking a blood sample or, more often, by placing your finger into a device called pulse oximeter. Those people who for some reason suffer from shortness of breath or fatigue may require supplemental oxygen. The other possible symptoms that you are not receiving sufficient of oxygen may be irritability, blue fingertips or lips, rapid heart rate, and ankle swelling. However, at times, people may not experience symptoms that they are not receiving enough of oxygen into their bloodstream. Symptoms can be from mild to moderate headache, restlessness, anxiety, confusion, rapid breathing, and high heart rate. If it is severe, it can lead to unconsciousness, seizures, coma, and bluish skin, lips, or fingernails. The major risk in such problems is damage of brain, which can begin within 5 minutes of oxygen deprivation. In chronic or severe cases, it can lead to severe organ failure, stroke, and death. If someone shows signs of severe breathing difficulty, confusion, or loses consciousness, you should immediately call for emergency services. In such cases, immediate emergency intervention is crucial. In this treatment, you may have to go for supplemental oxygen, may require to clear your airways, or some medication to treat the underlying cause. Now, how to increase your oxygen level quickly? To increase oxygen levels fast and naturally, you should practice deep diaphragmatic breathing. Use pursed lip breathing or lying down on your stomach to increase your lung capacity. Should go for fresh air, sit up straight, should stay hydrated, and if required, should go for supplemental oxygen, but under medical supervision. What is diaphragmatic deep breathing means? In yoga and pranayam, this is called Laghu Shwasi Pranayam. In this, you have to inhale slowly through your nose, allowing your stomach to rise, and exhale slowly through your mouth twice as long time as you had taken to inhale. In this, maximum oxygen is absorbed by your lungs. In pursed lip breathing, Inhale through your nose and exhale slowly through your pursed lips. This helps in keeping your airways open for a longer period of time. Lie down on your stomach or on your side, supported by pillows. Lying down in this position helps to open your lungs. This position helps to improve oxygen saturation. Sitting upright or standing straight with shoulders back helps in expansion of your chest, which is helpful in such cases. Drink water to keep your airways hydrated. This helps in transfer of oxygen. Oxygen level between 90 to 92% are considered low. Below 80 to 85%, it is considered dangerous, requires immediate medical intervention to avoid organ failure, while levels below 70% can be fatal. Vitamins good for oxygen are B1, B2, B6, niacin, biotin, folic acid, and pantothenic acid, which increases energy and in making of blood cells that carry oxygen to different parts of the body. For these vitamins, one should eat fish like tuna and meats such as beef, pork, and chicken. Leafy greens like spinach, beetroot, citrus fruits, berries, and nuts are also beneficial. For 100% blood oxygen level, breathe fresh air, should go for a walk, and should quit smoking in case you smoke. This is Bright Lifestyle. Please subscribe the channel. Thank you.